Hi, I am Dr. Gaurav. I'm a hair transplant surgeon and I've started this educational series on hair transplant and hair fall treatments. I've seen a lot of videos on internet posted about hair transplant, hair fall treatments. The knowledge is very scattered and I was shocked to see a lot of people who don't belong to the industry, who are not doctors by profession, putting a lot of content on hair transplant. So by this series, I'm trying to give a rough idea what you can look at when you are planning a hair transplant. So today in this video, we'll be covering basics of hair transplant. So hair transplant, a common question which arises in everybody's mind is whether I'm a right candidate for a hair transplant or not. As long as you have a good donor area at the back and you're losing hairs in the front and you want those density to increase, you can go for a hair transplant. The common reasons of hair fall are mainly genetics. So combined with a lot of other factors like environmental factors, stress, pollution, this genetic factor gets aggravated, and the baldness which was supposed to come in your later part of life comes in the early part, in your 20s, in your 30s. So nowadays we see a lot of people at the age of 20, 25 coming for hair transplant. Hair transplant is a one-day procedure. You come to us in the morning, you're free to go back in the evening. For 3 days, there's a band on your head like the tennis stars wear. After 3 days, the band goes off and you're good to go for your routine work. Normal sedentary lifestyle working, you can continue the next day. The only thing is the band is present, so it will give you an odd look. After third day when the band goes off, you can go off to your work without that band. There are no traveling restrictions post hair transplant. You can travel wherever you want to. The only thing is no smoking, no alcohol, no heavyweight lifting, no gymming, no swimming is advised for next 21 days. These precautions are there for next 21 days. Although I have made separate videos on post-operative care after hair transplant, I'll link those videos in the description. And the hairs which we transplant in hair transplant grow like your normal hairs. You can cut, shampoo and hair dye them. They are permanent, they never fall, they stay for life. The hairs which we transplant initially are small 0.5 centimeter long hairs. They grow when they start growing immediately, but from first week to 3 months, transplanted hairs are in shedding phase, they fall. After 3 months, they grow back at the rate of 1 centimeter per month. A good result of hair transplant comes in 6 to 8 months. Transplanted hairs requires no maintenance except for applying minoxidil lotion for next 1 year after the hair transplant to maintain the thickness and the growth rate of the transplanted hairs. In cases where people have existing hairs like the grade 1 baldness, grade 2, grade 3, there people are advised to be on hair fall therapies for their existing hairs. Because what happens is, immediately after hair transplant, in a year's time, you'll get a very good result, but you will tend to lose your existing and your result will start to fade off. To maintain the result for a longer time, the maintenance of existing hairs is of utmost importance, and you can design a hair fall therapy around. These were some of the basics of hair transplant, and if you have further more doubts and questions, you can leave a comment, ask me, I'll be happy to answer. Thank you.